So most people spend 40 years thinking and hoping that when they turn 65, all their healthcare bills will just drop. Not true. I hate to break it to you, but there's cost to it. Medicare is not free. If you're not prepared, especially in 2026, you're gonna get a big hit for retirement before you even get to see a doctor. So this year, the standard premium for Medicare Part B is $202.90. However, some people fail to understand that they're not incorporating a Part D plan or a supplement plan, and that could triple or even double depending on what choice you choose. So in this video, I am gonna build a 2026 budget for your Medicare expenses line by line so you can see which option is best for you. So you can know exactly what's coming out of your Social Security check. Welcome to Medicare Uncomplicated. I'm Sebastian Correa, a local health insurance broker here in Ocala in the Villages, Florida. Part A is free, but that doesn't mean that the health is free. When you go to the hospital, there is a coinsurance and a deductible. The deductible for 2026 for Part A is $1,736. So Part B typically is $202.90, and that comes out directly out of your Social Security if you retire. The concern though is, depending if you are a high income earner, if you're earning more than $110,000, or if you're a family of two earning more than $202,000 a year, you can get a much higher cost of that Part B. And the government's just not gonna accept anything other than just bill it to you. So for Medicare Part D, which is a prescription drug plan, the government doesn't set a standard price for it, but it is outsourced to individual private carriers or health insurance companies, and you have to go through a carrier to get one of these prescription drug plans. They range from $0 up to $100. It really depends on which one you need. If you're very healthy and you're not taking any prescriptions, get a $0 plan, because that's gonna avoid you getting a penalty. You'll be surprised most people just don't even think they have to get a Part D. If they don't, they get a penalty later. If I was gonna map out 2026 for a typical average earner that is turning 65 in 2026 and they needed to budget for what Medicare is gonna cost them, if they're going to just pay for Medicare Original, they're not gonna pay for Part A, right? But they are gonna pay $202.90 for Part B. They are also gonna find a plan for Part D. If they're taking prescriptions, it's likely gonna be anywhere between $0 or $50. That's an average. It could be more if they're taking a lot of prescriptions. And then that's not to factor in that if they're deciding to go the pay now or a supplement plan, then they're gonna pay probably an additional $200 to $250, depending on which letter they choose to go with. So all in all together for one person, I average to estimate if you're going the supplement route, you're paying about $450 per month per person. If it's a couple that's both turning 65 at the same time, that's $900 a month. Now, if you decide to go the Advantage route, you're looking more towards that $202.90. And you pay as you go. So in my next video, I compiled the 5 most common costly mistakes in Medicare. So make sure to watch the next video so you're not one of them.